Then next on stage will be Nina Ritter-Nielsen from Danish Technological Institute, and she will be giving a presentation of DTI Printed Electronics on-body eTextile sensors for physiological and neurological monitoring. So, Nina, the stage is yours.
Thank you. Whoa. Yeah. I'm going to also present a bit about what Danish Technological Institute is, because I have gotten this question quite frequently the last 2 days. Danish Technological Institute is not a university. I got that question quite a bit. We are an institute, so the German version would have been Fraunhofer. So we have been founded in 1906. We've been around for more than 100 years. And we help customers coming in and develop their product. And then we can do some small-scale production and help them going to high-scale production. We are more than 1,000 employees. And yeah, we are very commercially driven. So not a university. I got that question quite a bit. And yeah, I'm going to present a lot of different things that we have been doing right now, a lot with the healthcare industry. And all of the prototypes that I'm showing in my talk, you'll be able to see them at our booth. If you just go around into the next room, we have our booth there in the corner, very close to the food. So in the lunch break, please come by and ask all the questions and feel the materials that we have brought along. And my talk today is a lot about healthcare. We do a lot of other things. We also do printing for drones. We also do a lot of things with ESA and so on. But the focus today is with healthcare. And the reason for this is we see a huge push with this. Danes are getting older. Europeans are getting older. But generally in the Western world, we're getting older. In fact, in Denmark, I found the numbers that we see an increasement on 174% increase from 2024 until 2035 with people above 60 years old. So there's going to be enormous increase of people above 60 years old, which is in the end of their work life or already on pension. And not only by that people are getting older is not a problem in itself, except that they stop working. That is also that many of them have lung diseases, they have diabetes, they have heart diseases, they have arthritis, they have cancer. And we expect to see increase in these chronic diseases with 35% until 2016 in Denmark. And already in 2020, we saw that more people are living with multiple diseases. 46% of the population in 2020 had a disease and living with several diseases, and we expect to see increase there. That have an impact on how we have to think about the healthcare system and also therefore what we develop today. We are getting more elderly people, we have fewer people in the working age, we have fewer doctors, we see burnout, and this is not a Danish problem, it's a Western world problem. Already in Europe, and especially also in Denmark, we see hospitals at home being coming out there that you have to be home monitored. And that means that, of course, there'll be doctors and nurses coming to your home and helping you, but it will be your spouses, it will be your family which help you sometime if you have to go to the toilet and you can't do it yourself, or giving you food and giving you a clean bed and so on. That also means if your spouse is in the hospital, then you can go home and be home and relax and don't have all this sickness around. But when your spouse is hospitalized at home, then you don't want to be met all the time with that your spouse is sick or your family member is sick. So many of these vital signs we need to monitor when we have patient at home need to be invisible, not be able to see. So we see many of the coming in. Yeah, of course, they're looking. We need to have very good values. We need to be able to monitor people very well. But we definitely also need to have a focus that become invisible, that is nice looking. It's nice to wear on a longer period of time. And especially when the doctor is not around, we need